so Ray, we're going now into the segment talking about your first line treatment for multiple myeloma that started out with induction therapy. And I'd love for you to just sort of lay out, what was that regimen? What was that schedule for your multiple myeloma treatment?
Yeah, it was the highlights were a weekly visit to the infusion center to receive an injection of a drug called Velcade. Not much of a amount of fluid in that shot. It's probably that much fluid, and not a very long induction or an infusion process. So new to me. I had not been around an infusion center before. There's people in there that are there all day. You bring your blanket, bring your pillow, and bring a big long book or what have you, and you're there. Luckily for multiple myeloma and the Velcade injection, it's a process that it's a kind of a slow plunge on the injection. So that takes about 10 seconds, but soup to nuts, I can get in and out of the infusion center in an hour. That's with, my vitals checked, blood tested, and then, my drug, if my blood values are high enough that I can receive treatment, then it's, preparing the treatment, getting the injection ready from a powder into a liquid and at the pharmacy, and then inject it into me. So that was like the highlight. That was once a week. Built around that was a pill regimen, dexamethasone, steroid, which I'm not exactly sure why you take it, but you do take it, and a big dose of it too. And it was a once a week dose. And so that was timed for the same time as my Velcade injection. So it was Wednesdays. I would take this, I think it was 40 milligrams of dexamethasone. And later that day would get my Velcade injection. The idea explained to me is that sometimes, taking a big dose of steroids can kind of get you hyped up a little bit, maybe have difficulty sleeping as a side effect. But one of the side effects of the Velcade injection might be fatigue. So once you put those together, maybe there might be something that counteracts and you can go to sleep. The third and final part of my induction therapy was REVLIMID. And REVLIMID was a daily pill, 25 milligrams, which is a heavy dose, much higher than I take now in a maintenance therapy. And that was once a day. And I didn't really notice much side effects as it relates to the dexamethasone. Some of my friends who have gone through this, they're new friends. Being a patient, you end up as a member of this club. You never wanted to be a member of this club, but you are a member of this club, and you meet these other people who have your same diagnosis. And some of them have suffered with some of the traditional types of heavy steroid. People who might be taking prednisone and things like that. Impact on their eyesight and some other things like that. For me, I don't think I really noticed anything from the dexamethasone. REVLIMID, particularly at the start, a lot of skin rashes would present itself in my thorax and up on my neck and my scalp. So I used to get a lot of those. I mean, I go into the doctor and I went to go see a specialist once, and he's like, "Well, how are you feeling? Other than your skin rash?" That's the first thing he said to me. I'm like, "How do you know about this?" He goes, "Well, I'm a doctor. I can, pretty much tell." I'm like, "Oh, it was that obvious." It was the Velcade. I didn't really notice many of the side effects, but it's an injection given in the belly, and the injection site would bruise and suffer a big rash as well. You just keep looking for a fresh spot to put the injection. Skin rashes there. Digestive problems through REVLIMID and Velcade. Not exactly sure which one's which, right? But there's both constipation and diarrhea. And I know, some people might be thinking, "Oh, wait, how is that possible?" And some cancer patients under treatment can tell you, "Oh, it's possible." You can't have both. They can both present at the same time. And then there was fatigue. In thinking back, I don't know how much of the fatigue is, side effect of therapies, to also just, the side effect of my diagnosis, and as just the mental gymnastics that you play in your head so many times, particularly early in the cancer diagnosis, can be exhausting.
Very exhausting.
Mhm.
I like the way you said mental gymnastics, because oftentimes it does feel like that. You
Right.
know, it's like you're doing all these things.
Everything in my life, upon my cancer diagnosis and my initial regimen, which took place for like 6 months, everything I've always done has always had some sort of milestone and keynote, right? Whether it's athletically, I had an event, right? Or if at work, it was a presentation. If it was as a musician, it was a gig, a performance. And so everything would kind of build towards something. And I took that same approach as, my cancer diagnosis. All right, so I got to exercise, I got to eat right, I got to take my medication, because I was building toward fight night, to game day performance thing, right? And it was a realization like 2 weeks in. I went to go have dinner with my wife. My son was back from college, and we just went up the road. And I'm just sitting there in a restaurant. I was exhausted. I was beat, and it it took a while to come to the realization that, when you have a cancer diagnosis, when you have a chronic illness, every night is fight night. Every day is game day, right? It's not this training thing that you build up and you hit something. It is every single day. And you've got to be, cancer doesn't take a day off. You can't take a day off either. And you've got to judge your efforts to get that through. And a big part of that for me, it can be mental, right? And when I was first diagnosed, I thought about cancer pretty much as soon as I woke up. And about the last thought that went through my head at night was cancer. And a lot of times in between it was cancer, right? That's not the case anymore, right? It's with time comes, a different type of acceptance, and you do things differently. But, I think that's kind of important to tell people early on in their journey is like, yeah, you're tired. Give yourself some credit for being tired. It's okay to be tired. You've got a lot going on. Just know that this is every day is fight night and game day, performance day. Be able to adjust what you need to adjust. Be able to go in for a long marathon, because you're fighting this forever. You're a warrior, and you're coming through the other side. And there's going to be times you don't feel great, but it's okay. It's don't beat yourself up on it. Just adjust and get back up to speed.
I'm so glad you brought that up, Ray. For both cancer patients and myeloma patients in particular, this idea of how much is going on in your body, right? So I remember even with my non-Hodgkin's, I'd be frustrated because I'd be so tired, but I'd be upset because I wanted to be productive or do something. And that just makes it worse. But on top of that, for myeloma, I hear this from other people diagnosed with multiple myeloma, is the I don't look sick part of it. And so, there's like this disconnect, but actually there's so much going on internally, obviously, that your body's doing and working hard. And it's a lot to sort of have to process, right?
Yeah, and I'm really glad you brought up the I don't look sick perspective, because sitting through with a group with other patients, one of the things that new to me is people caring about their hair and losing their hair, and I have friends that adjust their treatments and do not take certain treatments because they don't want to lose their hair, and they're women. For me, I'm like, what's the big deal? And it's like, well, I'm not a woman with cancer. It's I did lose my hair through my treatment, and I'm certain we'll get to that in a little bit. But when a man loses his hair, it's not because he's sick. It could be because of fashion, it could be genetics or what have you. It could be a whole bunch of different things. In our North American society, if you're a woman and you're bald, it's pretty much a first thing people jump to is like, oh, she's going through some health problems. She's ill, right? And nobody wants to go around. I don't think anybody wants to go around with people looking at them and going, oh, they're ill, right? And a big mental approach for a lot of patients to come across is when you're going through treatment. There's just kind of a cliche, right? It's the cancer's not so tough. It's the treatments that are really tough. You're going through treatment. Sometimes you don't look so great. You can be pale and all these other variety of things. And no, I don't think people really want to look like they're not feeling well. And that's a big mental thing, I think, to overcome. There has to be a certain time and a certain degree of acceptance that you have to give that, yeah, that's the way I am. But, you have to also, find a way to push through it. Don't let that be all consuming to you. And
No,
you're talking
100%.
about, maybe not, feeling really well. That really, if you're not feeling really well, then, it's really easy to kind of like sit on the couch, and lay in bed for a little while. You sit on the couch, lay in bed for a couple of days, then you don't, it's not making you feel any better. It's making you feel like worse. You're like losing your power and losing your energy. And so, maybe I don't feel like going to the store. I don't feel like cooking. Maybe I'll just get some fast food. So then you're not eating very well. And that's certainly not going to make you feel any better. And so then you're feeling even more tired. And then you're feeling kind of depressed because you're feeling so tired and you're eating fast food and doing this, that, and that. And it's just, and it's okay for all of us to do that at some point in time. We're all humans, right? Give ourselves a break, right? Really important for everybody. Cancer patients, maybe even more so. Be able to identify that, pick yourself up, say, all right, today, starts the first step. Let's get out, let's get a little exercise, let's get a little strength, get a little power, different frame of mind. Let's go forward.
Let's go forward is a great way of putting it. I think that's very well said. And I think it's this balance of giving yourself that grace or credit, to use your word, to be human, to have that reaction, but then at some point to be able to do whatever it is to pick yourself up and keep moving forward. So thank you for sharing that. And before we move on, I wanted to laundry list with I know the dexamethasone, I'm just going to sort of put it to the side because the steroids have their own sort of, it's a whole nother ball game. But with the Velcade or bortezomib and the REVLIMID or the lenalidomide, you were talking
I'm impressed. I can't, I'm a patient that takes them. I can't give you the scientific name.
Just in case people see, hear it differently, but thank you for that. So with those two, I'm hearing there were GI issues. There was constipation and diarrhea. There were rashes. There was fatigue. Does that cover the major part of what you were feeling?
Yeah.
Okay.
Particularly early, big doses of REVLIMID. The skin was probably the biggest issue for me. Followed up with it. Yes, in particular, the rashes and the reactions. I think REVLIMID caused the rash, the reactions at my abdomen, the site injection sites of Velcade. Significant. I mean, they're tender, big red splotches on my belly, and the associated itching and things like that go along with it. So yeah, skin and the digestive problems.
I'd love to hear what helped with each of those. So we could start with the rashes. Like, did anything help, like creams? And then if you could talk about the constipation and the diarrhea, what helped for you there as well?
Yeah, I don't believe going through immunotherapy did anything about diarrhea. For constipation, Miralax, daily supplement, odorless, tasteless powder mixed in water. Take that daily. I still take that daily through my ongoing treatment. With the rashes, I believe I did get some prescription drugs and creams to combat the rashes. I can't remember what those drugs were, but I didn't use them much. I was already taking a whole bunch of pills, and I felt as though I can kind of live through the rash. And as my body kind of adjusted to REVLIMID, I felt those needs went away. For the injection sites, just a regular over-the-counter lotion to combat sooner or later it's going to be dry, flaky skin and itchy skin. So, but I'm wanting to think that maybe for the REVLIMID and the rash, even some over-the-counter anti-allergens like Claritin. So like today, I still take Zysol once a day just to help combat potential skin problems.
Thank you. People are always asking about what helps with these things, and it's so helpful to hear it from someone who's actually gone through the treatment and the side effects. So that's perfect. Obviously hair loss, because you had gone through, you did experience a hair loss for this induction therapy part of it. No, you didn't.
So induction therapy, none of that hair type of thing. In fact, I knew that if I was going to get a stem cell transplant, I was going to go through chemotherapy, and going through that chemotherapy, almost for sure I was going to lose my hair. So in induction therapy, I thought, well, if I'm going to lose my hair, I'm not going to shave, and I'm not going to cut my hair, and then I'll do it my way just before I go through therapy. We'll have a big party and we'll shave my head and we'll cut off my beard. So actually during I started getting this mountain man look as I was going through my induction therapy, because I wasn't cutting my hair and wasn't shaving. And I was just preparing for the time when I was going to shave it down before chemotherapy took it for me.
Perfect. Yeah, that makes sense, because usually I don't see that people are losing their hair from the induction therapy. And I was looking at your timeline, and it said that you went ahead and you just said, let's shave this hair. The date you gave me was around September, and then it was October through November that you were preparing for your stem cell transplant.
No, actually, that's when I was going to my stem cell transplant. So March is when I started my induction therapy, and they were telling me, 3 to 6 months you'll take, and then maybe a stem cell transplant. We'll just see. We'll see how you progress. And me being like, wanting to be an overachiever, I'm like, well, let's do it sooner. I went to go see a specialist. I think it was in May. So it's just a couple months into it, but 3 to 6 months to me in May, it's like maybe we start stem cell transplant like in a couple of weeks, right? And she gave me some great advice. She's like, well, hold on a second. What are you in a hurry for? You're responding well to your induction therapy. Let's keep going at it for a little bit. There's no need to rush, right? I'm like, well, I just, coming from my perspective, if it's, 3 to 6 months, wouldn't 3 months be better? Not necessarily, maybe 6 months, maybe he might not ever need it, right? Induction therapies, if I had maybe a less aggressive form, or if I didn't have 90% of my bone marrow being cancerous, maybe I could get to this MRD level where it was such a minute amount of cancer in my bone marrow, where it's like, we'll just put you on a maintenance dose, keep you steady. And so that was the first time I'd even heard about that stuff. I'm like, oh, this is pretty interesting. Going back again to my tendency, even now, to compartmentalize. I wasn't learning anything about stem cells and stem cell therapies because I was focused on induction therapy. And what could I do? What could I do to help, present a garden of my body to help grow the fruits and vegetables, healthy cells that I want, as opposed to the, weeds, the cancer that I don't want, right? So I was concentrating on clean eating and drinking and exercise, helping, in my mind, at least, helping the medicines do what were intended to do. So, it was maybe May when, we got this whole idea. It's like, maybe, we don't need to rush into a stem cell transplant. I continued to make progress, but that second bone marrow biopsy probably would have been in early September. It's like, well, you made great progress. It's gone from like 90% for bone marrow to 10%, but the markers are there. You're not at an MRD level through your induction therapy. Now's the time to probably think about a stem cell transplant. Stem cell transplant was, you started off with chemotherapy. That's like, it's not day one, it's day two. And that chemotherapy is going to be a chemotherapy that probably results in losing your hair. That was going to take place in mid-October. So at the end of December, it's like, all right, let's shave it off. So had a party in December party. And that was a fundraiser for the Multiple Myeloma Research Foundation. It's like, I'm a musician. I've had excessively long hair several times in my past. And just used to be a point of contention with a lot of our friends. It's like, cut your hair, blah, 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 blah. It's like, this is your chance. You can cut it. It's $20 a swipe with the clippers, right? The head shaving business is a pretty good business. We raised like $250 that night that we matched $500 to the Multiple Myeloma Research Foundation just to, go bald my way. I was going to go bald sooner or later anyway, so it went bald my way.
You should have a song called that. I don't know if you have that.
Yeah, maybe I'll start on that. And if I get anywhere with it, I'll send it to you.
Awesome. We'll play that under your video.
Yeah. Going bald my way. It's I said it's the second day. The first day is a surgery for a catheter emplacement. Chemotherapy can be extraordinarily harsh going through your veins. So I had a catheter placement. I was also going to go through daily blood tests. And that's a lot to ask for your veins. So it's a Hickman catheter put in my chest, a very quick procedure. Took two songs, on Pandora. My nurse assistant who put it in, it's like, what do you want to listen to? I'm like, Van Halen's my favorite band. You got like a hair metal channel. It's like Pandora here. pop it in. I don't remember the first two songs, what they were, but I did at the time. I mean, it's kind of a conscious sedation type of thing, in and out. That was the first day. Then the second day, it's like, let's get started. Nice big heavy dose of Cytoxan. And if I'm jumping too far ahead, stop me. But I do want to share with some patients about Cytoxan and chemotherapy-induced nausea. I thought I knew what nausea was, and I thought I was going to be okay with it. And I learned through my very first chemo, this big, massive dose of Cytoxan, that that's not the case, right? So we had to be in very close proximity to the cancer center. And so we actually relocated to Menlo Park, California, to be close to it. And that first stop by, you need to be, like, I think within an hour of the cancer center. In the Bay Area, that means that could be like 3 miles away, so you need to be kind of close. So we were staying in a hotel, and I knew I was going to be there for, like 5 meals. And so my wife and I go to the store, and it's like, okay, meal number 1 is going to be that. Meal number 2 is going to be that. Meal number 3, meal number 4, meal number 5. It's easy, right? So day number 2, day after my surgery for the catheter, I spent all day with Cytoxan. It gets synthesized through your body through urine into your bladder. So it's a lot of fluids that get pumped in through you. You need to drink a lot, but they also, I carried around a little suitcase full of literally connected to a saline solution connected to a pump, and a suitcase and a roller bag. And that was the day before, the day of, and the day after. And so it was all day sitting in the infusion center, getting it. I had lunch there, feeling pretty good. I watched Thursday night football that night, feeling pretty good. And it was about 11:30 at night. And, my wife's just kind of getting in bed, go to sleep. And I'm like, Lori, I need you to go to the store to get something. She's like, oh, can we get something from the kitchen? None of that stuff that we had picked out, just the thought of it was making me nauseous. I was on all these anti-nausea medications. We taken them readily, but this was sweeping over me. And all I could think was like, maybe it's like some crackers and like some ginger ale or something like that. Word to advice to folks, you got to stay on top of your meds. That's just a given. They say, take this like every 4 hours, take it like every 3 hours, 59 minutes and 59 seconds. Don't miss it at all. Stack them. They'll give you like 3 different meds. Take this one, take that one, take that one. Keep it up. Always keep a little something in your stomach and have a lot of choices, because whatever gets presented right in front of you is something that you're not going to like. And that was a recurring theme for the next 6 weeks, and it got, there were points where like my wife would like ask me like, hey, Ray, do you want, and just her saying words were like making me sick to my stomach. And like, stop. You cannot, I know you're doing this out of love and asking me if I want something, but you can just say, stop there. Like, can I get you something? And let me come up with the words, because even the words can to make you nauseous. So, I thought I knew what nausea was. I didn't know what nausea was. I do now. And it can be crippling. It can be debilitating. Through chemotherapy, that first time around, I did not have episodes of vomiting. The second, third times around, I did for a couple of days. No one likes doing that. But it's nausea is a thing, and it's probably not the nausea that you've experienced previously in your life before you go through chemo.
Can I just say agree
Yeah.
on everything that you said? It's interesting. I think from an outside perspective, it's like, oh, nausea, no big deal, nausea. But no, it is, like you said, it can be debilitating. And I love hammering home the point that you brought up, which is stay ahead of whatever schedule they give you. Because again, once you feel it, once you start chasing this nausea, it's so hard to get a hold of it.
Yeah.
And the fact that you talked about 3 different medications, I think the 3 most popular ones, and you can correct me if I'm wrong for your case, but Zofran's popular, Compazine, and Ativan. These are 3 very, popular ones.
Those were the ones.
All right.
And you can stagger them, right? And so like one's like every 6 hours, one's every 4 hours, but you can take them. There's times where you double them up, right? And definitely do that. And I like what you said, Stephanie, about chasing it. For me, there's a very, very fine line between hunger and nausea, and so, keeping something in your stomach, and don't think about your favorite food. I think, what's kind of common advice is don't think about eating your favorite food going through treatment, because it's not going to be your favorite food ever again. So save that and do something else, but have some choices for you. Wet and cold were best for me, way over something that's dry. One of my chemotherapies created mouth sores. And going in ahead of that was a cryotherapy. I'm sure you're familiar with it. In your conversation, Stephanie, it's chewing on ice for 15, 30 minutes. And the principles behind it are the ideas that it's going to freeze up and make your GI tract cold. And as it gets cold, the capillaries and things like that will narrow up, and maybe not so much blood with all that chemo, i.e. poison, going through it. Maybe minimize your sores. I didn't really have sores, but I did have kind of like one in the back of my throat. And you have to take some pretty big pills, and pills that can start me getting gagging. It's like, say, kiss that thing, and last thing you want to start doing is start gagging when you're nauseous, right? That's when you're sitting down there and you're fighting the urge to vomit for 5 minutes, 10 minutes. You're just like, trying to get yourself together, just kind of to muscle down a horse pill of that you're trying to get down. So another handy thing to do, pill crusher, something like that, or something to cut pills. There's some pretty big ones for the possible infections that you might get, these antibiotics that you need to take, these antivirals that you need to take as well. So cutting those in half, maybe even crushing them, putting on a little bit of ice cream or something like that, and working it down. Because beware of things that can kickstart your nausea. You've been doing everything right, but the next thing you start gagging on a big pill because you have a sore in your mouth, and then it gets you right back to step one again.
These are such great tips because they're very real, ones that people can really utilize and give it a try, because as we know, no two people track the same, and something that helps someone may not help another, but just being able to have options. I think that was part of why I felt like a resource like the patient story is so important, is because I just wanted to have, when I was a patient, options. And I felt like I didn't have my options. I didn't know unless I talked to other patients, So thank you, Ray. Wrapping this part of it.
Well, and I just want to emphasize what you said, the options, just because I say something that's great, but, listen to 3 different people and give yourself a whole bunch of options. So like, for example, when it comes to food, if you need 5 meals, have like 20 ready. Also, redefine what you think a meal might be. It doesn't need to be, it's not going to be, 2,500 calories of a whole bunch of stuff, a big platter of food, just a bite or 2 here or there, gives you sustenance, gives you strength, gives you power, and something that you can stomach. So.
Absolutely. And just to wrap this part of it up before we shift to the next segment, which is living with myeloma. The transplant went well, and then I know they kept you at the hospital for 4 nights. The platelets were low, of course, and then they kept you under observation to make sure that the new stem cells that had engrafted. And thank you for that description. But I do want to ask: is there anything else from that recovery period in terms of guidance for people recovering from the transplant that you want to share?
A stem cell transplant, where they're using your own stem cells to reintroduce in your body, it's all in all, it's like 6-7 weeks. It starts with the catheter placement, and then a massive dose of that Cytoxin, and then you're free to go in 24 hours. So that's really just kind of kickstarts. It fights myeloma. It kills myeloma cells, but it also like kickstarts your immune system going like, what's going on here? And be prepared for a kind of a wackiness. When your nurse is giving you chemotherapy, they go to extraordinary pains and measures to make sure none of that touches the outside of their body or their clothes, right? They are in complete, hazmat type of things, and they're injecting it straight into your heart through the catheter, right? And that is a weird thing to kind of get over. It's like, wow, you don't want to spill any on your scrubs, and you're putting it straight into my heart. But so okay, but it is what it is. Cytoxin kickstarts your body's immune system. It's like, what is going on here? Start ramping up the production of stem cells. Then you go through, for me, it was about 11 days of a Neupogen injections that I could not give myself because I'm, a candy when it comes to needles, right? So I made my wife give them to me instead. They're things that a lot of patients give themselves. I couldn't do it. So she would give me 3 shots of Neupogen in my belly a day, again, to kind of spur all these blood cells or these stem cells to get coaxed out of the bone marrow into your bloodstream. Because once they're in the bloodstream, that's a lot easier to get taken out of than as opposed to, say, 200 bone marrow biopsies to get your stem cells out. So it's a lot easier to skim them off your bloodstream. For me, that was about 11 days of that, I think, until I finally got a blood count that was high enough to go through apheresis. Today's video update is on the move. Say hi, Miss Lori.
Hello.
Hi. Yeah, the update, I think is best put to song. And the reason that we're on the move is it's apheresis day. It's apheresis day. They take my stem cells today. It's apheresis day. Apheresis is a dialysis type of treatment where blood comes out, gets centrifuged around by volume. Those the stem cells are kept. The rest of it gets put back into you. That can take maybe sessions over 3 days. For me, I was lucky. I did it in 1 day, about 4 hours. Once you start, you can't stop. And that was the end of the first step. And that was great because after that, you get a couple of weeks where you kind of rest up and get your body ready. And all said and done, it was like one big chemo day. I didn't feel great that night and the very next day, but after 24 hours, I was feeling better. The shots were kind of a mental thing to get over. And then I had a 2-week break. So that was kind of cool. Then, then the rubber meets the road. The harder part is the second half. That's 2 massive doses of chemotherapy in a 3-day period. So I think for me, it might have been, I think it was a Friday and a Sunday. Some big, massive dose of one particular radiation, a day off, and then the Myeloma that you talked about. That's the one I needed to do cryotherapy on. And I took it very seriously, and I certainly suggested doing the same, other patients, getting their mouth as cold as possible. It's not a very long infusion. It's maybe, 15, 30 minutes afterwards. But then, those 2 big, massive doses of chemotherapy, I think NCBU and Myeloma, designed to completely wipe out your bone marrow. And you start beginning to feel those effects because your bone marrow is what makes your blood cells. And, say red blood cells, for example, carrying oxygen, the fatigue, will not have any more red blood cells until your stem is, except for what's in your body. And over time and quickly, those kind of break up and dissolve. They're going around, they're getting banged up, through their journey through the vascular system. They disintegrate. And so your blood cell counts start going down and you have nothing in your bone marrow to get that back. They give you your stem cells back a couple of days later after that second dose of chemotherapy. And then it's a waiting game until, it engrafts. And it's 11 days. Those are long 11 days. During that time period, I had nausea after those chemotherapy treatments. Getting the stem cells back. They package it up in DMSO, and so everyone's going to have a kind of a weird side effect, and that's going to be a body odor. Depends on your body and what type of body odor you get. Mine was tomato soup, and that's something my family, my wife and my sister they don't even like talking about it. I mean, and it takes a second. It's amazing. Your stem cells come back in, and the next thing you know, the room smells like tomato soup. I got it. Say hello, Samira.
Hi. What is this?
This is a little video for the family. But there's my blood cells.
Oh yeah.
Cells.
Yes. It's hit.
Working their way in.
This every time. Okay.
But those 11 days after my stem cells being introduced, my blood counts, just kind of went to 0. I needed a couple of red blood cell transfusions. They're so low. I started popping a bit of a fever. And I have low blood pressure to begin with, but with the fever and a low blood pressure, there could be anything, right? So all these prophylactic doses of their guesswork of very strong antibiotics got to the point where I needed to be hospitalized. So moving out of the hotel in Menlo Park and into Stanford Hospital for 4 nights. I probably could have left after 2. My fever was gone, but they like, let's just wait until we see some platelets. And that we know that it's engrafted. And then once I was discharged, I think I spent one more night at the hotel, just kind of cleaned some things up because I needed an appointment the next morning. Then it was home for the recovery. But those, those first 2 doses, and those like that, but those 11 days until I grafted, probably the first 9 of those, so there's like 10, 12 days, very long days, very tiring. It's a tough road.